Hello, everybody. Good evening. Um, if you're over here in West Africa, good evening. Um, Good morning, good afternoon. If you're seeing this from other parts of the world, and whenever you're seeing this, welcome to the CareTeam Africa's. Welcome to the CareTeam Africa's webinar. Um, the World Neglected Tropical Disease Day. So yesterday that was the 30th of January, was the World Neglected Tropical Disease Day. And CareTeam Africa is hosting this webinar to mark that day and provide education, health education to Africans. Okay. Have three guest speakers, who are here to talk about these neglected diseases, what they are, what are the risks, how can we protect ourselves. They're here to give us the information that we need to better protect ourselves and our loved ones. So we have Dr. Benedicta, we have Nurse Becky, we have Justina as well. So we're going to be doing something differently this time around. I'm not going to be introducing them. I'm not going to be talking about them. I'll give them the microphone and they will introduce themselves, and they will go ahead and start. So the first person to start is Dr. Benedicta. She will introduce herself and then proceed with her presentation. Then we'll be having Nurse Becky also introducing herself and then proceed with her presentation, and the same for Justina. So once again, welcome to the webinar. I am Jeremiah Ayobami Obadefi, and I'm excited to be a part of this. Hi, Dr. Benedicta. Good evening.
Hello, Jeremiah. Good evening to you as well. Unfortunately, as I said, I couldn't share my screen because I have a problem with the camera. So kindly pardon me. I'll do my best so that you can hear me or get me whatever I'm coming to share with you. All right, so thank you so much, Jeremiah, once again. Can you please confirm whether you can see my screen and hear me as well?
Yes, we can see your screen.
All right, thank you so much. It's a pleasure being here, and thank you to you and your team, Care Africa. We hope that you do so much for the health care delivery in the African setting. My name is Benedicta Ford. I'm a medical doctor. I'm in Ghana and I work at the Eastern Regional Hospital. I'm also the president of the RTC Foundation, which is an NGO which is focused on promoting healthcare education and also embarking on social impact projects which are geared towards alleviating the burden caused by cancer, road traffic accidents, and neurological diseases in our society. I also do entrepreneurial works. I'm part of a company called EB Med Stores, where we provide quality healthcare services, products including suturing kits, stethoscope to healthcare professionals as well as students. So I'm happy to be here. And as we mark the neglected tropical diseases, we hope that you have an understanding of what they are, how to protect yourself, and also if you know anyone who has any of them, or if you are privileged to embark on or be volunteer to a particular program or initiative which is geared towards eliminating such diseases, you do it wholeheartedly. So thank you so much for having me. And I pray that you have the best of time. It's unfortunate that I can't see or I can't see our audience, but I hope it's as interactive as possible, even as you listen to me, right? So we are talking about neglected tropical diseases tonight, and I'll be very brief with my overview. Neglected tropical disease, there are a wide range of diseases, as you can hear, or as you can even see by the names. They are a group of disease, so we are not talking about one, we are not talking about two. Currently, WHO picks it's about, we have about 20 neglected diseases. Initially, it was 13, and then it moved to 17. Now we are nearing about 20 of them. So you can see that there are quite a number of diseases. And you can even get to know about them or have an idea of them based on the name, the designated name that we have given to these group of diseases. And when you hear neglected, it should tell you that these diseases are neglected in a way, or there's some form of neglect, right? So the term neglected, as you can see, is when you think about these group of diseases compared to some diseases where WHO and other institutions, including research funding, right, they do not take we have not paid much attention to these neglected tropical disease or these group of diseases, and that's why we have pegged the name, or that's why they have the reputation for being neglected, because as compared to, let's say, HIV, where there have been numerous campaigns, numerous research, now we have treatments for HIV. These are neglected tropical diseases until recently that we started paying attention to them, and so they are neglected in a sense. So as I mentioned them, or as we go ahead and we mention them, to be honest with you, I am not sure if some of you, especially those of you in the urban centers, some of you have seen people with these diseases. And even as a healthcare professional that I've been practicing for about 2 years, I tell you that I have not seen many people with these neglected tropical diseases. So as much as they are neglected, they're also found in the tropics as well. So that's where we get the tropical from. They're also found in the tropics, and not just the tropics. And many times they are found in the poor communities, neglected or impoverished communities. So when you come to even my setting, I'm currently in Koforidua in Ghana. Where I am currently is I barely see people with these diseases. But if I am to travel to the very rural areas, I am likely to find people with these diseases. So they are they are not too common within our urban centers, or they are not too common, especially with where we find a lot of access to healthcare facilities. Impoverished areas where there's poor access to healthcare facilities, where they have unclean water, where they have they are limited in the access of food. That's where you find some of these diseases. So they are, one, neglected because there's poor funding, people do not recognize as much, and people do not even know it that much. And you can find them in very impoverished communities. So that's a thing that you have to take note of. And so they are not just one disease. It's not just one disease, as I said earlier. It's a group of diseases which are caused by viruses. Some of them are caused by bacteria. Some of them are caused by parasites. So they're a wide range. So that's what we term as the neglected tropical diseases. And I'll give you some characteristics of these diseases so that you have an idea of what we are talking about, right? So they are, as I said earlier, they are, I'll start with my far right. It says that they majorly affect people living in the tropics. So you shouldn't forget that tropics, neglected tropical disease. And one thing that you should know is that because they are neglected so much and because of where they are found, many times those who are affected do not have the resources, the money to either take care of themselves or have access to healthcare facilities. So many times they depend on the WHO and other non-profits who organize mass drug administrations, who organize outreach so that they are able to have the treatments that they need. So these are people who are in so much need, but they do not get the need that they really need. And so there's also limited research for them, as I said earlier. So if you take HIV, for instance, and even malaria, some people may classify malaria as part of the neglected, but then the WHO has and doesn't do so, right? So for malaria, there has been a lot of research, there has been a lot of treatment options and modalities that have come up, including now the vaccination that we have seen, right? So there's a lot of research, but as compared to these neglected tropical disease, research is very limited, and they are very chronic and persistent. One thing you should know about these diseases is that they don't kill you immediately, right? So they are diseases that do not kill you right now. They cause what we call disability. And so they go on for a long time, and they really affect the quality of the life the person who is affected lives. So let's say for a disease like the trachoma, which causes blindness in the long term. So for a person like that, when the person is affected, the person doesn't die immediately, or it's not there's no mortality immediately, but then the person has to live with blindness. And you know how blindness affects the individual's life, right? So that is one of the disabilities that we are talking about. It affects people's life drastically, even though it doesn't cause immediate death. So that's the purple one, which is shown that it causes disability. It causes suffering even more than it causes death. So the focus is not death. The focus is on the quality of life that the person lives. And so that's one of the things that we have to look at. And one thing, and the last thing I would like you to know, is that it's been there for quite a long time. And so people ascribe it to a very ancient, or people say it's an ancient group of disease because it's been there for a long time. Some of them can even be found in the biblical text, something like leprosy, that a lot of us are quite familiar with, right? So these are examples, and those of you who are listening, I would like you to look through them. Can you identify at least 5 of them that you are familiar with? If, as I said, unfortunately, I can't see your engagements, but if you are able to identify 5 of them that you have seen before, I think I'll be far too proud of you, because as I said, even in my position as a medical doctor, I've been practicing for, it's quite a short time though, for just 2 years. It's only a case of schistosomiasis that I have really seen. I haven't seen a case of lymphatic filariasis. As I said, in the vicinity that I work in, I've not seen it before, but these are examples of them. So we have the lymphatic filariasis, that's the elephantiasis, which is commonly pronounced by, as we all know it, as elephantiasis, and it's significant because it affects the lymph of the individual. So the individual has a very big leg. So that's the term, that's the notion that we get from it. Elephantiasis, the person's feet become so big that it looks like the feet of the elephant. So that's what you can identify with when we talk about elephantiasis or lymphatic filariasis. It's one of the major NTDs or most common ones that we have. We also have the schisto, which is popularly known as the bilharzia. For this one, we commonly identify it with bloody urine, because most of them, when they're infected, they have blood in their urine. And in very endemic communities or communities where it's very popular, when they urinate, or the children, most of them, they find urinating blood as a very common occurrence, because that's what they live with, or that's what they're familiar with. They do not know that this is a disease and not a common occurrence. So schisto is one of the common ones. We have trachoma, which also leads to blindness, right? So this one is also common, mostly by flies. We have the river blindness, we have Buruli ulcer, we have the dengue, we have leprosy, we have Chagas. There are a number of them, as I said. Now we are nearing about 20, and quite recently, WHO added rabies and snake envenomation, right? So initially these were not part, but then WHO thought it wise that these are of public health importance that should be added. So we take quite a good notice of them, and so that's why you find rabies as one of them, and also snake envenomation. For my practice, most of the snake envenomations that we have had, they were quite severe. I had one who died, and we also had one who had a very bad case where the bleeding wasn't stopped, so it was of a hematological cause, or the venom was a hematological cause. So the patient in question even had a cerebral bleed, right, which is quite severe. So these are things that we want to be aware of them. We don't want them to be neglected forever. We want to be aware of them so that we can do what we can to make sure that we get rid of or we eliminate these diseases, right? So I will mention a few health implications of some of them. As I said, there are quite many, and then they cause disability. So for schisto, what I mentioned, schisto will cause bloody urine. It will cause painful urination as well. Sometimes you may have blood in your stool or your feces. It can lead to the enlargement of your liver and then your spleen. It can also cause cancers, right? So bladder cancer to schisto is found to be implicated, that especially in endemic areas, when they are children, they will have the bloody urine. They do not take care of it, or they do not see it as a problem, so they continue to have it. And once the disease continue to have its way in the individual of the person, later on in the years, they develop the bladder cancers that we have, or they present to us with in the hospital. So the lymphatic filariasis too, some of them have swelling either of the genitals or the limbs, the lower limbs or the legs, or both of them, right? So these ones cause major disability, because once the individual has it, sometimes it's difficult to work. It's also difficult to go about with their daily activities. There's a lot of stigma attached to it, so it affects their lives in totality, right? So we also have the soil helminth. So these ones are they cause more nutrition. So an example is the hookworm, which likely causes anemia. So for prolonged infestation, these children have anemia. It affects their nutritional state, and they later have what we call the malnutrition, right? In the acute case, they may have abdominal pain, they may have diarrhea in the legs, but when it goes on for a long time, they do not grow well, so they become very malnourished, and then they have poor quality of life. The onco and then the trachoma, as I said earlier, both of them causes the blindness. And then onco can also have skin manifestations where they have some nodules on the skin, so it affects the skin of the individuals and causes skin problems as well. So as you can see, these diseases, they do not cause immediate death. right? They do not cause immediate mortality, but then they affect the quality of life of the individual. So these are some of pictures that you can see. So for this particular individual, on your far left, you can see, if you can appreciate it, the very big limb here, right? So that's a lymphatic filariasis affecting the limb here. And here on your right, you find the Burley ulcers in various stages, where it has formed a nodule here. It forms the plaque here. It can lead to edema as well. And this is the full-blown Burley ulcer that some of us are quite familiar with. And you can see this is very, very devastating for an individual. Many times, these wounds take quite a while to heal. And so dressing the wound, it becoming severe and getting worse, this affects an individual's life, although it doesn't cause immediate death, right? And this is one of the cases of river blindness that you may see. And you can see the eye here obviously affected, and it causes blindness in the long run. And you can imagine living with blindness. So these affect the quality of life of the individual. So as I mentioned earlier, so for the cost of living with the neglected tropical disease, so some of them will have a lot of pain, chronic pain and disability. So for someone who has, let's say, the Burley ulcer, you can see if you have a wound such as this, you'll be in a lot of pain, right? So they are in constant pain and disability as well. The children, especially those who are infected with these soil helminths, and then other, let's say, even with the lymphatic filariasis, it's quite difficult for them to go to school. So some of them will miss school. The adults will not be able to work as they should. For someone with blindness, it will be very difficult for the person to farm, especially in such areas where farming is their main source of earning and living, right? It causes social stigma as well, and isolation. So you can see the impact that these neglected tropical disease have on the individual. And one thing is that we mentioned earlier that they are found in individuals or areas where there's a lot of poverty. And once you have a poor person who, let's say, feeds or depend on farming for a living, if this person has river blindness, or if this person loses his or her sight, how will the person be able to continue farming? So it leads to, a cycle of poverty, meaning that once they are affected, it becomes even more difficult for them to fend for themselves. And so this, it leads to the continual perpetration of these diseases, and lets these diseases to thrive, right? So in the, I'm concluding by bringing these up in the spirit of commemorating this day. I would really recommend, and I really applaud the works of some of the giants in Africa here who have done so much. And I remember one of them who was once my lecturer in medical school, called Dr. Linda Deborah, with her husband, Dr. Deborah, who did so much for Ghana and Africa in terms of lymphatic filariasis. So those of you who are students here, you can search. I'm sure that most of the great papers or academic writings you find on lymphatic filariasis, you likely find Dr. Deborah to be amongst them, either Dr. Linda Deborah or Dr. Deborah, the husband, right? So they did so many, they did quite a number of research. They came up with a lot of treatment modalities for these neglected tropical diseases, especially the lymphatic filariasis. So they came up with one treatment modality, which I think include the drug doxycycline, right? So you can search on it. And WHO accepted it. So they did what we call the mass drug administration. So many times, because the people who are affected lived in very impoverished settings, they do not have the money to purchase if they are to be bought, right? So we do what we call the mass drug administration. We go to a place where there's a lot of these disease, or this disease is very much prevalent there, and then we donate or they distribute the treatments to the individuals. They do it at regular intervals, right? So that it can reduce the burden of these disease. So you can find a lot of works by Dr. Linda Deborah on such, especially, and even recently, there has been such in the Upper East, I think Upper East or Upper West region of Ghana. So that is one of the things that is happening to manage these diseases, right? So the KCCR also is also doing quite a lot. So you can also search on them, especially those who are academically inclined or those who are in the health space who are interested in helping such. And the KCCR also is a research institute. They also do these research and also help in the management of such diseases, especially the NTDs. So you can also research, get to know them even on other social media platforms to see the great work that they are doing, especially those of you here who are quite interested, right? So that's one of the things that is happening, which is the mass drug administration. So they go to such communities and then they give the medications. There's also the targeted treatment, which is based on endemicity. It's also similar to the mass drug action. So for them, they go to the areas which are endemic in particular diseases. So let's say this particular community, they have onco, they have trachoma, they have, let's say, lymphatic filariasis as well. So the treatment modality that they will give during the mass drug administration has these three medications, or has medications for these three in them, right? So that it is targeted towards what they need or towards the burden that is prevalent in that particular society. So that is one of them. And so you and I can also help or participate in WHO's action by also engaging or participating in community education. As I said, some of us, in all sincerity, may have not seen it before. We may not see it before, but once you have the knowledge and once you're able to talk to someone who may be in that particular community, or if they are volunteering opportunities, as I mentioned, with these mass drug administration, and then outreaches towards such vicinities, it will be an incredible opportunity for you to learn about these diseases and also participate in the elimination strategy. And also one thing that we would need would be to have very good healthcare access to such areas, because sometimes they do see the beginning of they do see these diseases in its early form. So the nodules, they see them before it becomes a very big sore. So they see them, but because healthcare access is very far from them and it's not causing too much pain initially, it's not causing any death, you rather keep it with them, and then it will continue to become worse and worse. And so providing healthcare services in such areas are also great. And so those who embark on community health outreach, community screenings, make sure that once you are going to rural areas like this, you do not just check their BPs and then the sugar and that's all. You also look out for such diseases. You check whether there are some nodules on their body. You check for these sores, if there are ulcers, and if you have a very interesting, if you have a lot of insight, you can be able to see patterns, or let's say blindness among the older people. If let's say you go to a community, we're coming to do a health screening, and you realize that all the elderly people they are bringing, all of them are blind, it should signal to you something, or should give you a sign that, oh, this particular community, most of them are blind. What could be the cause? Is it trachoma? Is there rubber blindness? Is there anything that could be solved or preventable And so that's one of the things that you and I can do as individuals to help in the management or in the strategic elimination of neglected tropical disease. Even as WHO does this work, we also participate. And so thank you so much. It's been a pleasure. And as I said, I'm so sad I couldn't engage you, but I hope we meet another time. Thank you so much for the opportunity, and I hope you learned a thing or two. Thank you.
Thank you very much, Dr. Benedicta. Thank you for dishing this out. Yes, so we are currently streaming on YouTube, and we'll be taking questions and feedbacks from YouTube. So as we get those questions, we'll have them documented, and then we'll send them across so that we can have them answered as we proceed. So once again, thank you very much, Dr. Benedicta, for that beautiful presentation. We'll be back, to follow up on it. Now we'll be moving to the second aspect of the presentation, which will be by Nurse Becky. But I just want to point out before Nurse Becky comes up that this World Neglected Tropical Disease Day 2026, again, the theme is Unite, Act, and Eliminate, right? So we've seen the aspects, the introductory aspect of it by Dr. Benedicta. Want to look at the act aspect of it now. Want to look at it from the perspective of how we can get some of these things sorted out. So once again, welcome, Nurse Becky, and we are ready for you. So good evening.
Good evening. It's a pleasure to be here on this platform. I really want to commend CareTeam Africa for what they are doing in creating awareness and sensitization on this neglected tropical disease, and the grace of God will get to the ends of the earth. So my name is Ogiri Rebecca Onume. I'm a registered nurse, and I'm quite passionate about preventive healthcare and public health. So I'll be taking the action part of this. That's how our everyday actions can prevent these neglected tropical diseases and also eliminate them entirely. So when we talk about ending neglected tropical diseases, it's very important to remember that medical interventions alone are not enough. So prevention starts in homes, schools, markets, communities, through our everyday actions and informed choices. So how we go about our daily activities also contributes to the prevention of neglected tropical diseases. We have heard from the speaker before me. She has spoken so much on the common neglected tropical diseases that we have, some of which include schisto. We also have trachoma, lymphatic filariasis, and the likes. So I'll be highlighting some simple everyday actions that we could carry out that to significantly reduce the risks of NTDs. And some of these actions include regular hand washing with soap and clean water. the prescription is soap and clean water. So not just washing our hands with water, but after each and every activity, after contact with surfaces, before eating, whatsoever activity we want to carry out, it's important that our hands are washed with soap and clean water. Also, it is important that we use designated toilets for proper disposal of human waste. It's important that we don't litter the environment with feces, not just going to a nearby bush or just anywhere on the road, because littering the environment or not properly disposing human waste exposes us to some of these NTDs. Also, wearing of footwear to prevent worm infections. So most of these in rural communities, we could see that not everyone has the exposure to knowing what NTDs are. It is important that we always wear footwear to prevent worm infections, because some of these NTDs, like filariasis, are transmitted by worms. Then keeping faces clean, especially in children, to prevent trachoma. Reducing mosquito breeding sites. We all know, we are all conversant with malaria. Reducing mosquito breeding sites through environmental sanitation to reduce the spread. So in Nigeria and Ghana, schisto remains very common in communities because of streams, water bodies which are contaminated. So most of these West African countries have limited access to sanitation, safe water, which increases the exposure to worm infections. So one of the ways that we could prevent NTDs in these areas is also to have a provision of safe or clean water, and also to avoid contaminated water in streams, in riverine areas. So I'm going to move to the community mobilization aspects of this act. That's how community mobilization can eliminate NTDs. I just highlighted how our everyday actions, what we could do every day during our daily activities to prevent NTDs. So I'll be going to the community aspect of this. So, some ways that communities can play a critical role in NTD prevention, where water, sanitation, and hygiene practices improve. So some of these community practices that we could do to eliminate and prevent NTDs include community cleanup exercises. We could have mobilization of community members and people living in communities to carry out clean-up exercises in their communities, whereby they clean the environment, they make sure the environment is cleaned, the clean drainages. They just carry out activities to clean up the environment. Also, maintenance of water sources. I earlier highlighted that some of these NTDs are majorly spread by contaminated water. So it is very important to have a clean and safe water system. So community actions could include maintenance of water sources, ensuring that all the water sources, all the water bodies, the rivers are kept clean, they are free from contamination as much as possible. Then also the promotion of household latrines, that every household should have a proper latrine system. Also, we could have school-based hygiene education in the communities, especially in the rural areas where the children, the peoples, the students are educated from an early age on common practices they could carry out as part of hygiene, prevent NTDs and the spread of these local endemic diseases. I'll be moving on to the signs and symptoms, some of these symptoms that NTDs presenting. And one of the ways that we could prevent the spread of the disease is first by identifying the symptoms. So if we're able to early recognize the symptoms, however mild they are, it will go a long way in the prevention of NTDs. So some of the common early signs include persistent itching or rashes. If you notice, or if you know anyone that suddenly starts or comes down with persistent itching or rashes, it is of great importance not to ignore this sign, but to move to the nearest health facility for the person or the individual to be checked. Another common sign is blood in urine, which is peculiar to schistosomiasis, blood in urine. So if you notice a bloody urine or you notice blood on passing, you know anyone with that complaint, such cases should be referred to health facility, a proper health facility, as soon as possible. Another sign and symptom is swelling of limbs or genitals, which is common in lymphatic filariasis, as the doctor also highlighted and showed us pictorial examples of this disease. So if you notice swelling of limbs or swelling in the genital area, this attention should be drawn to it and quick medical intervention should begin. We also have eye discharge or redness, which is sign and symptom associated with trachoma. So if you notice that, if it is noticed, attention should be drawn to it. We also have chronic abdominal pain, anemia, or poor growth in children. So generally, if we are able to detect these signs and symptoms and not just ignore, and quick medical intervention begins, it will reduce the spread. It will reduce the spread of these tropical diseases. It will go a long way in curtailing the spread. But I think one of the tendencies we have as Africans is to self-medicate or take actions into our own hands. So it's very important that we don't just take actions into our own hands, but going to appropriate facilities, going to appropriate health facilities to report such cases. Immediately any sign and symptom is detected, it is important to go through the nearest and appropriate health facility to report, and then follow up will be done. This will really go a long way in preventing the spread of NTDs. Lastly, I'm going to be speaking on the health sensitization aspect, which is health awareness, health education. So just like we are doing today, just like CareTeam Africa has given us a platform to create sensitization and awareness on NTDs, education, sensitization, and creation of awareness will go a long way in prevention of the spread and also the elimination of NTDs. So this health education should start in schools, in the rural communities, should start in the grassroots. It should be delivered in languages so that the audience, the communities will be able to understand, even in the simplest terms of their comprehension, what all these diseases entail. So it should be delivered in local languages so that virtually everybody at the grassroots is able to learn, is able to be aware of these diseases and how they could prevent them, the spread of NTDs through their everyday actions and make better informed choices as individuals. Also, community leaders and religious institutions and then the local media should, it's another platform that could be used. That community leaders should mobilize, religious institutions should mobilize, and the local media should take action in promoting awareness and sensitization of these diseases that have been neglected. Then also there are certain myths and misconceptions about NTDs. Let's not attach everything to village people or whatsoever. So one of the ways that we could also create awareness is to address these myths and misconceptions, these common myths and misconceptions. So everyone should be enlightened, the from the children to 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 the old people. Everyone in the community should be enlightened. Everyone should know what these diseases are. Everyone should know their common signs and symptoms. Everyone should know how they could prevent them, contributing their own quota by their everyday actions. So lastly, I would like to end by saying that ending tropical diseases in Africa, it will not just happen, or it will not happen only in hospitals or conference rooms. It will happen in homes, it will happen in schools, it will happen in communities across West Africa by promoting simple hygiene practices, early symptom recognition, timely health seeking behavior, continuous education. We can significantly reduce the burden. We can significantly reduce the burden of NTDs, and it will go a very long way in combating, in fighting against NTDs. Empower communities remain our strongest weapon against neglected tropical diseases. Thank you very much.
Wow. Thank you very, very much, Ms. Becky. Thank you for that beautiful piece. We have some takeaways, which I'll be talking on shortly, but I would like Farm Justina to come on real quick, introduce herself, and dish out her own part of the presentation. Farm Justina, you have the microphone. Good evening.
Hello, Jeremiah. Thank you. I'm sharing my screen. Hello, everyone. Good evening, good morning, depending on what time you're watching us. My name is Justina Okonkwo. I am interested in pharmacoepidemiology public health, and health outcomes. And this evening, I'll be walking us through the treatment, adherence, and continuity of care of NTDs. Please hold on. Okay. So I'll be covering the proper use of medicines in NTD management, importance of adherence and treatment completion, dangers of self-medication, and sustained care. We'll be focusing more on the most common and high-impact NTDs in Sub-Saharan Africa, which Dr. Benedicta have highlighted. And as she mentioned, they are termed neglected because they receive less attention and funding compared to other diseases. Okay. Some of these diseases are silent. They are quite silent, while others might come up with symptoms that are very visible, like bilharzia and some worms. They do not always cause a fever. They're just silent in there, but they still your energy, growth, and at the end affect sight. That's common with the river blindness, onchocerciasis. Millions of people in Sub-Saharan Africa are affected, but these diseases are usually preventable. And Nurse Becky has taken us through that, means on how to prevent these diseases. For the treatment, they are usually treated based on the class of causative pathogens. For the protozoans, we use the antiprotozoal agents. For bacteria, we use antibiotics. For the helminths, we use antihelminthics. For viruses, we use antiviral agents, while for fungi, we use antifungals. So let's look at some NTDs and common medications that are used. For schistosomiasis, we use praziquantel. It works by paralyzing the worms, so your body can eliminate them out. And it's best you take them with food to reduce the bitterness and to prevent nausea. While for helminths, which include the hookworms, whipworms, roundworms, we use antihelminthics just as albendazole, mebendazole. They act by impairing the worms. They act by impairing their ability to absorb glucose and also deplete their energy stores, leading to their death. It's usually advisable to treat everyone living together. Once there is someone down with any of these worms, it's advisable to treat everyone in that household at the same time. While for onchocerciasis, we use ivermectin. Its mechanism of action is by killing these worms and thereby relieves itching and saves the eyes. Usually the worms live for years, and it's advisable treatment is repeated every year. While for lymphatic filariasis, that's elephantiasis, DEC, that's diethylcarbamazine, is used alongside albendazole. It's quite important that medications are used the right way. So people should not do not self-medicate. Always consult your healthcare provider to prescribe the right medications for the right condition and for the right duration as well. For the doses, medicines are usually calculated specific to you using your age or weight. And most of those medications used in treating NTDs they work better after having a good meal. So it's advisable to have your meal before taking them. Speak with your healthcare provider to tell you how to take these medications. They are the professionals to tell you how to take these medications. For the side effects, it's quite expected, just as with every other medication. You also speak with your healthcare provider on what to expect while taking these medications. It's quite important that people adhere to the dosage regimen to prevent resistance. When you feel better, it does not mean when you feel better before completing your treatment duration, it does not mean that the parasites are gone. It's quite important that we complete our dose and for the stipulated duration. Stopping before the given time allows these parasites to survive. They get stronger, multiply, and become difficult to eliminate. We should also note that treatment is not just for us, it's for the whole community in helping to eliminate this disease. When we eliminate, for those that are infected already, we need to treat them completely to prevent these eggs entering the soil and someone else picking them up. So I'll be walking us through the dangers of self-medication, and it's quite important to always consult your doctor or your pharmacist for professional care. People most times see a skin rash and assume it's an allergy or a heat rash, when it could be early stages of a disease, just like onchocerciasis. And most people tend to use steroidal creams as the first choice, and that's wrong. Steroid creams might just hide the rash, but allows the parasites to keep multiplying. Underdosing also leads to resistance and makes these parasites more difficult to eliminate. We should also learn to avoid using herbal mixtures from these street self-acclaimed doctors. Many of these mixtures are not regulated and can lead to liver and kidney failure, while delaying you from also seeking the actual treatment you need. So to take home, we should remember that getting the right medication is the first step. Taking it correctly is the next step. And also we should improve our hygiene and take our medicines with clean water. And the hygiene practices have been mentioned by Nurse Becky. Elimination of these NTDs is a collaborative effort. In cases of outbreaks, it's quite advisable that everyone in the community be treated for the NTDs in that area. Thank you, and that's all from me. Yeah.
Thank you very, very much, Justina. Yes, thank you very much. It's been an informative and quite educative session so far. The theme for the World NTD Day 2026, basically, like I mentioned earlier, the theme is unite, act, eliminate, right? So we had Dr. Benedicta talk about the unite aspect of it, the overview, how healthcare professionals are coming together. She also mentioned some of the contributors, to some of the knowledge, the research that we have regarding some of these neglected tropical diseases. And Nurse Becky Nurse Rebecca talked about the actions. Okay, what do we need to do? What does the community need to do? What do the individuals need to do? How do we prevent? How do we protect ourselves, right? And then the eliminate aspect of the theme, talking about the drugs, talking about how to actually get it treated, right? So I'll do a just some points, some key points from my own notes, which I took in course of the presentation. And I would also like to share a few things with you from Parents Healthcare or from CareTeam Africa now. So now Dr. Benedicta was talking, and then she mentioned some of the costs of the neglected tropical diseases, things like the chronic pain, things like reduced productivity, right? For students, it would be missed schools, right? For workers, it would be reduced productivity. And then one other thing is discrimination, generally in Africa. People tend to run away from people who have some of these conditions, right? So you find that form of stigmatization. And then, of course, the poverty gap also increases because someone that has not really had enough money to eat well, you don't have enough money to buy food and eat as you want to, or to meet some of your basic needs. And then you now, contract some of this tropical diseases. And then you begin to spend the money on medications. The money you don't have enough of is spending them on medications to get treated, So the poverty gap kind of widens, right? So we don't want that. And Nurse Rebecca mentioned something. She said, let's not leave everything, to village people. Let's not attach everything or link everything to village people. Yes. This is why we're having a webinar like this and health education program, so that by the time we begin to see some of these things not happening to us now, because now we are aware, now we know we can actually prevent them, we can protect ourselves. So we don't live our life to chance. We don't live our life to the the village people conversation. And Farm Justina mentioned, don't self-medicate. Very, very, very important. I think this is something we as Africans need to hear over and over again. When one of our family members fall ill, many of us in the African society automatically become the doctors, the nurses, the pharmacists, and whatever or whichever healthcare profession we choose to represent at that time. It's not done that way. It's not right. It's not right. So don't self-medicate. Seek care. Seek care. Seek care. And when you're placed on a particular medication to treat any of these conditions or diseases, complete it. When you start, complete it, finish it. You need to adhere to your medications. Okay, so if you use it halfway, you're setting yourself up for resistance, just like antibiotics. So when you're trying to treat some of these parasites and you don't complete it, you're just setting yourself up for something not quite good. So once you get started, see to it that you finish. Okay, so I have a very brief presentation for you from CareTeam Africa. And yeah, so once again, good evening, everybody. My name is Jeremiah. I I'm the founder and the CEO of Terrains Healthcare. Okay, so this is basically we're looking at closing the gap, right? The essence of this presentation is to move from NTD awareness to sustained care, right? So we have the awareness. How do we sustain the care? And that's basically what I'm presenting on right now. But before I proceed, let me quickly tell you about CareTeam Africa. So CareTeam Africa is the flagship product of Terrains Healthcare. Okay, so CareTeam Africa is not the company. Terrains Healthcare is. And Terrains Healthcare has set CareTeam Africa up to provide that bridge, that bridge where we can pass through, we can go through in terms of improving care delivery in Africa. I'll talk more about it later, but let's quickly proceed. Now, why does CareTeam Africa exist? Okay. It is quite important to note that awareness alone is not sufficient. Okay, awareness alone is not sufficient, and the challenges, some of the challenges we face at the moment. Let me enlarge this. Yeah, so we have a challenge. Many individuals lack a clear understanding of their health conditions, and even many receive information too late. So it's one thing for you to lack understanding, of the health condition, and it's another thing for you to receive the information late. That's a challenge, and this has provided, it has created a gap, okay, which is a critical disconnect between the initial care and the long-term health outcomes. So the time it takes for you to seek care and the health outcomes long-term, the gap is quite wide. And this is why CareTeam Africa exists, to provide a trusted platform where questions are answered and where care is continuous. So we have a platform where you can ask questions. You don't have to rely on the village people sentiment. You don't have to rely on some of the things you get online from people who do not even know anything about healthcare. So we have a platform where you can interact with actual healthcare professionals, where you can ask questions about anything related to your health. And this is the mission of CareTeam Africa. Now, health education is our foundation, right? We understand that knowledge is a primary tool for reducing fear as well as to empower you, okay? Because we know if you have the right knowledge, the right information, you can do a lot, right? There's so much you can do with the right knowledge, the right information. And because of this, we have our health education program as a continuous process. Okay, so we view health education not as a one-off event. Okay, so we look at it as an ongoing journey for every individual. Okay, we also try as much as possible to help you make empowered decisions or more informed decisions, because understanding improves your health literacy, right? And because now you have a better understanding of your health, you can make better decisions when it comes to making sure you live a healthy life, and when it comes to you being proactive taking responsibility for your health, right? And of course, the proactive health, very important. We don't want to wait until you are knocked down. We want to help you prevent being knocked down. Okay, so when people truly understand their health, we believe that they would form this sense of responsibility, where they take active responsibility for their health. And then we move from awareness to action. It's not enough to have the information. It's not enough to have the I know what to do, to I am taking the necessary steps today, not I will take the necessary steps tomorrow. Okay. Yeah. Yeah. So the care team role also involves turning the webinar discussions into real life health improvement. So we want to make sure that you take deliberate efforts, to improve the quality of your health. Okay, that's one of the aims that we intend to achieve, and we look forward to um, achieving. Just a moment, please. Okay. Now we have some guided care replacing guesswork. Now, when you grow up in the African community, you understand the fact that um, professional guidance actually eliminates the risks associated with self-medication. There is a lot of misinformation out there. There is a lot of supposed or alleged health information online, like I mentioned, from people who do not even know a thing about health. And they will go online, put a lot of things, and then you go there, you try to look for information, and then you're fed with a lot of junks, right? It's a big problem. It's a very big problem because reliance on non-professional advice, and when you do trial and error, often it worsens the health outcomes. Okay, so if you're supposed to get better, you get worse. And nobody wants to get worse. Nobody wants to feel more sick. Everybody wants to get better, right? At least everybody should want to get better. And because of that, we have a solution, which is direct access to healthcare professionals. At CareTeam Africa, we give you direct access to healthcare professionals that will provide you with clear, with simple guidance that will basically be tailored to your needs. And fortunately, we're also expanding into other territories, trying to get healthcare professionals across Africa who would be able to communicate with you in your local language. Okay. And the result of this would be that there will be no more guessing, there will be no more confusion. The only thing you're going to have will be evidence-based, and it will be guided care for everybody. So we want to try as much as possible to reduce the guesswork. Start guessing, someone is feeling this way. Okay, let me just let's try this, maybe it will work. Let's try that, maybe it will work. We eliminate that because we want care to be continuous. Okay, and we understand that disease elimination actually requires sustained engagement, and it goes beyond the first clinical contact. Rome was not built in a day. These neglected tropical diseases cannot be eliminated just through a single prescription. It requires commitment to the full journey. The fact that you have a prescription does not mean your sickness or disease is gone. You have to follow through. You have to take your medications. You have to follow through with the advice given to you by your healthcare providers, right? CareTeam Africa also emphasizes follow-ups. Okay, so we don't just leave you to say, hey, here's your prescription. After you've consulted with us, here's your prescription. Go and get this drug, and then that's all. No, we'll follow up. We'll reach out to you the first time. In most cases, we reach out to you the second time. We ask you questions. We want to know whether you are adhering to your medications. Are you taking your drugs as you've been directed to or advised to? We want to know if you're feeling better. I want to know, we want to be a part of your journey, your health journey. So there's that constant follow-up just to make sure and let you know that, look, you're not alone in this. You're not alone, and we don't leave anybody behind at CareTeam Africa. We don't leave anyone behind, right? And this really helps us to, we're looking at improved outcomes. We want to have a long-term health success that will be built on the foundation of continuous support as well as proactive monitoring. Responsibility thrives when individuals are supported, and then we want to make sure you are not left to navigate your health alone. But there's one thing we need from you. We need you to take ownership of your health. We need you to choose to be deliberate about your health. We need you to choose to be intentional about your health. We need you to choose to take responsibility for your health. Okay, when you take responsibility for your health, you don't wait until your condition becomes critical before you seek help. You don't wait until you are out completely, before you start seeking for help. You seek care as soon as possible, timely care. And we are committed to providing you with this supportive environment. Okay, so we have a community of healthcare professionals, and we have a set community as well for our clients, where you can also get to relate and interact with people, clients, people going through various health conditions just as you. So if you have any health condition at all, and you are subscribed to CareTeam Africa, we want you to know that you're not alone. Okay, so you also get to learn from the experiences of others. There are some people who are feeling what they've felt what you're currently feeling now, and then you want to know how they got through it, right? It's quite interesting when you have people to talk to, to let you know that, look, you're not alone. Because of that, you're better together. So personal responsibility is something you should take very, very seriously. There's a lot we intend to do at CareTeam Africa, and we are doing, because basically our focus is to impact the community positively, the African community. CareTeam Africa was built by Africans, and it's built for Africans. Okay, so we want to protect your family. We want to help, foster a strong preventive culture that would reduce the overall community disease burden, right? Because when we give awareness, we expect, that people follow through with the necessary actions just to prevent, the occurrence of many of these conditions. And we want to emphasize community strength as well, because we understand that individual health literacy translates directly to collective resilience, and it's not limited to the neglected tropical diseases. We believe that when you have the knowledge and you have the guidance to follow through with the actions, you would prevent a lot of these conditions, a lot of these diseases. You lead a better life. And it's not just an individual thing, it's a community thing. Yeah. CareTeam Africa is a partner. If you want to stay healthy, we're not looking to reach out to you just when you are sick. We're not just for when sickness strikes. We're not looking out for you only when you're sick. We want to be your partner. We want to help you stay well. And because of this, you are invited to join our regular health education sessions. So we're going to be having series of health education programs this year and beyond. Want you to join. If you've not subscribed to this channel, please do. If you're not following CareTeam Africa on social media, please do. We'll be having a lot of health education programs that would help you take charge of your health. Yes, we also have consultation services, right? We have a wide range of healthcare professionals, qualified healthcare professionals across various fields who you can take advantage of to speak to them. Now, we have a model at CareTeam Africa. We believe that your health is very, very, very important. We believe that you are a VIP, and a VIP shouldn't be treated as a commoner. A king should be treated as a king. A queen should be treated as a queen, right? And because of that, when you book an appointment with us at CareTeam Africa and you're like, hey, CareTeam Africa, I want to speak with healthcare professionals. What we do is we set up a team of healthcare professionals for you. So you don't just get to speak with one healthcare professional, you get to speak with a team of healthcare professionals at the same time as the queen that you are, as the king that you are, Your Majesty. You get to speak with a doctor, you get to speak with a pharmacist at the same time, seated to listen to you and to advise you. You could also get to speak with other healthcare professionals, maybe a nurse, maybe a physiotherapist, maybe a nutritionist, depending on your need, based on your chief complaint. We believe healthcare should be holistic, and we should not look at healthcare only from the lens of one professional, but from the collective and collaborative effort of everybody involved, as a team. Yes, that's what we do for you, Your Majesty. We treat you as the king that you are, as the queen that you are. And you can ask questions, early. When you take charge, when you take part, when you become when you take part in what CareTeam Africa offers, when you subscribe to CareTeam Africa, you have free access, you have easy access. Ask questions, on time. You stay connected for continuous follow-up and support. You can wake us up at 1 a.m. and say, CareTeam Africa, I'm going through XYZ right now. What can I do? And we would have a team ready to attend to you. Okay, so let's move from today's conversation basically to a lifetime of better health. Okay, so it's not enough to have the information, but it's quite important that you take action to do better, to take responsibility for your health. Okay, so the final message I have for you is, especially as it relates to the neglected tropical diseases, these diseases thrive where awareness is low, okay, and where support is also absent. But when people are educated, when people have the right information, and when people are supported, when they are guided, prevention becomes possible, okay, and elimination becomes realistic, because now people are aware, people are empowered. Where there is information, there is power. right? CareTeam Africa is supporting your journey from awareness to action through sustained health. You're not alone. We are bridging the gap. We are making healthcare accessible, and we are here for you. So you can check us out. You can just go to Google, search for CareTeam Africa. You find us there. You find the link to our website. That's careteamafrica.org. And you can also look us up on our social media platforms, on Facebook, on Instagram, on TikTok. Look us up, and let's be in touch. CareTeam Africa is here for you. This platform was built by Africans for Africans. We are here for you, Your Majesty. We are here to serve you. We are here to help you take responsibility for your health so that you can lead a better, healthier life. Once again, I want to say a very big thank you to our speakers, Dr. Benedicta, Nurse Rebecca, Farm Justina. Thank you very much. Thank you for being a part of this. Thank you for educating us. Thank you for opening our eyes to the neglected tropical diseases and for guiding us on what to do, how to prevent them, how to seek help, how to stay true to our medications, to finish the course of our treatment. And I just want to say thank you for your presentation. Education is very important. Knowledge is power, right? And it's the first fight that we can, the first punch we can throw at NTDs. So thank you, audience, for everyone who streamed this live. Thank you. And for everyone who will be watching this later, thank you for watching till this point. Once again, I am Jeremiah Ayobami Obadofin, the founder and the CEO of Adherence Healthcare, and it's a pleasure to have you join the stream. Thank you once again. And so this is the end of the webinar. We're trying to say right now we don't have questions, but if questions come up, if you have any questions at any point, you can just leave them in the comments because this is streamed live. So if you have any questions, just drop them in the comments and we'll attend to you. We'll give you answers. We look forward to having you next time. Look forward to seeing you again. We look forward to educating you. So stay in touch. Check us out on our website, careteamafrica.org. Check us out on social media. And until next time, do have a very good evening. Bye from here.